Question 1. A patient receiving IV nitroprusside for hypertensive crisis has BP 90 over 60 millimeters of mercury, confusion, and bright red venous blood in the line. The provider orders to titrate the dose. What is the nurse's most critical action? A. Stop the infusion and draw serum thiocyanate levels. B. Reduce the dose by 50% and monitor. C. Flush the line and restart at lower rate. D. Administer sodium bicarbonate IV. Answer. A. Stop the infusion and draw serum thiocyanate levels. Rationale. Bright red venous blood with confusion suggests cyanide toxicity. Continuing or titrating the drug is fatal. The infusion must be stopped and thiocyanate level checked immediately. Question 2. A patient on norepinephrine for septic shock suddenly develops mottled skin, MAP 55 millimeters of mercury, and cold extremities despite adequate fluids. What is the priority nursing action? A. Verify central line patency and check for extravasation. B. Increase the norepinephrine dose. C. Bolus with 500 milliliters normal saline. D. Add vasopressin infusion. Answer. A. Verify central line patency and check for extravasation. Rationale. Skin mottling with decreased MAP may indicate extravasation causing peripheral ischemia. Necrosis can occur if the drug leaks. Check patency before increasing the dose. Question 3. A dopamine infusion is ordered at 10 microgram per kg per minute. The patient's HR rises to 140 bpm and BP 220 over 110 millimeters of mercury. What is the nurse's immediate priority? A. Stop dopamine and notify the provider. B. Titrate infusion to 5 microgram per kg per minute. C. Administer labetalol IVD. Assess cardiac output trend. Answer. A. Stop dopamine and notify the provider. Rationale. Excessive tachycardia and hypertension indicate dopamine overdose. Titration alone isn't enough. The infusion must be stopped to prevent arrhythmias or stroke. Question 4. A patient receiving IV amiodarone develops QT prolongation, QTc 550 milliseconds, and lightheadedness. Which nursing action takes highest priority? A. Stop the infusion and prepare for magnesium sulfate. B. Continue and notify cardiologist. C. Reduce infusion rate and reassess in 15 minutes. D. Obtain potassium and calcium levels. Answer. A. Stop the infusion and prepare for magnesium sulfate. Rationale. QT prolongation places the patient at risk for torsades de pointes. Magnesium corrects electrical instability, but infusion must stop first. Question 5. During insulin infusion for DKA, the patient's potassium ion level falls from 4.0 to 2.6 milliequivalent per liter, and ECG shows U waves. What is the most critical step? A. Stop insulin, administer IV KCl, and place on monitor. B. Continue insulin with 5% dextrose. C. Notify provider for ECG evaluation. D. Decrease insulin by half. Answer. A. Stop insulin, administer IV KCl, and place on monitor. Rationale. Severe hypokalemia can cause ventricular arrhythmias. Insulin drives K intracellularly. Stopping insulin prevents fatal cardiac arrest. Question 6. A patient on IV lidocaine reports dizziness and slurred speech. The cardiac monitor shows widened QRS complexes. What should the nurse do first? A. Stop lidocaine and notify provider immediately. B. Obtain serum lidocaine level. C. Decrease infusion by 25%. D. Prepare for magnesium administration. Answer. A. Stop lidocaine and notify provider immediately. Rationale. Neurologic and cardiac symptoms indicate toxicity. Immediate discontinuation prevents seizure and cardiac arrest. Question 7. A sedated patient on high-dose propofol develops metabolic acidosis, pH 7.12, lactate 7 mol per liter, and hypotension. What is the nurse's next action? A. Stop propofol and prepare for alternative sedation. B. Administer IV fluids rapidly. C. Titrate vasopressors. D. Give sodium bicarbonate. Answer. A. Stop propofol and prepare for alternative sedation. Rationale. These are signs of propofol infusion syndrome, a fatal metabolic condition. Drug must be discontinued immediately. Question 8. The patient receiving heparin has platelets of 45,000 per cubic millimeter and new pain in the left calf. What is the nurse's priority? A. Stop heparin and notify provider immediately. B. Administer protamine sulfate. C. Increase infusion rate. D. Elevate leg and apply heat. Answer. A. Stop heparin and notify provider immediately. Rationale. Low platelets with thrombosis indicates HIT, heparin-induced thrombocytopenia. Heparin must be stopped before clot extension occurs. Question 9. A patient on magnesium sulfate has DTRs 0+, respiratory rate 8 per minute, and urine output 20 milliliters per hour. What is the immediate intervention? A. Stop infusion and give calcium gluconate IV. B. Notify provider and monitor O2. C. Reassess reflexes in 15 minutes. D. Reduce dose by half. Answer. A. Stop infusion and give calcium gluconate IV. Rationale. Absent reflexes and respiratory depression indicate magnesium toxicity. Antidote must be administered immediately. Question 10. The nurse is preparing to administer digoxin to a patient with potassium ion 2.9 milliequivalent per liter and HR 48 BPM. What is the best action? A. Hold digoxin and notify provider. B. Administer digoxin with potassium supplement. C. Give half dose and reassess. D. Document findings and continue. Answer. A. Hold digoxin and notify provider. Rationale. Hypokalemia increases risk for digoxin toxicity. Holding the dose prevents bradyarrhythmias. Question 11. A mannitol infusion is ongoing when the nurse notices bilateral crackles, JVD, and confusion. What should the nurse do? A. Stop mannitol and notify the provider immediately. B. Decrease infusion rate and reassess lungs. C. Administer furosemide IVD. Check urine osmolality. Answer. A. Stop mannitol and notify the provider immediately. Rationale. Mannitol can cause fluid overload leading to pulmonary edema, especially in renal impairment. Question 12. A patient on nitroglycerin infusion develops hypotension, BP 70 over 40 millimeters of mercury, after sildenafil use earlier that day. What is the nurse's immediate priority? A. Stop the nitroglycerin immediately. B. Give 250 milliliters NS bolus. C. Notify provider. D. Position supine with legs elevated. Answer. A. Stop the nitroglycerin immediately. Rationale. Nitrates plus sildenafil cause fatal hypotension. Stop the drug immediately before volume expansion. Question 13. During epinephrine infusion, the patient develops chest pain, ST elevation, and BP 210 over 120 millimeters of mercury. What is the priority action? A. Stop infusion and notify provider. B. Administer morphine. C. Decrease rate by 25%. D. Administer nitroglycerin. Answer. A. Stop infusion and notify provider. Rationale. Hypertension and chest pain suggest coronary vasospasm due to excessive stimulation. Immediate discontinuation prevents infarction. Question 14. The patient on vasopressin for septic shock develops confusion, sodium 118 milliequivalent per liter, and seizures. What is the nurse's immediate action? A. Stop vasopressin and prepare hypertonic saline. B. Reduce infusion by 25%. C. Give furosemide IVD. Notify provider and continue monitoring. Answer. A. Stop vasopressin and prepare hypertonic saline. Rationale. Hyponatremia-induced seizures indicate water intoxication. Vasopressin must be stopped to prevent cerebral edema. Question 15. A nurse is infusing IV potassium chloride when the ECG shows peak T waves. What is the first action? A. Stop infusion immediately. B. Notify provider. C. Check potassium ion level. D. Reduce infusion rate. Answer. A. Stop infusion immediately. Rationale. ECG changes signify hyperkalemia. Infusion must be stopped to prevent cardiac arrest. Question 16. A patient on morphine PCA is found unresponsive with shallow respirations and pinpoint pupils. What is the nurse's next step? A. Stop PCA and administer naloxone IV. B. Call rapid response and start CPR. C. Administer oxygen 15 liter per minute via mask. D. Notify provider immediately. Answer. A. Stop PCA and administer naloxone IV. Rationale. Classic opioid overdose. Antidote naloxone must be given immediately before arrest occurs. Question 17. A patient receiving nicardipine infusion has BP90 over 50 millimeters of mercury and HR 120 BPM. The provider orders to continue. What should the nurse do? A. Hold the infusion and call the provider. B. Continue per order. C. Decrease rate by 50%. D. Give NS bolus and monitor. Answer. A. Hold the infusion and call the provider. Rationale. Continuing would worsen hypotension and reflex tachycardia. Nurse must advocate for patient safety. Question 18. A patient on IV furosemide develops hearing loss and ringing after a rapid push. What must the nurse document as the cause? A. Ototoxicity due to rapid IV administration. B. Dehydration from diuresis. C. Hyponatremia-related confusion. D. Potassium loss-induced neuropathy. Answer. A. Ototoxicity due to rapid IV administration. Rationale. Rapid push of furosemide damages the auditory nerve. Must be infused slowly over 2 to 4 minutes. Question 19. While giving alteplase, the patient develops slurred speech and unequal pupils. What is the immediate priority? A. Stop the infusion and activate stroke protocol. B. Continue and notify provider. C. Check glucose level. D. Assess BP and temperature. Answer. A. Stop the infusion and activate stroke protocol. Rationale. These are intracranial bleed signs due to thrombolytic use. Stop immediately to prevent fatal hemorrhage. Question 20. A dobutamine infusion is titrated upward when the patient's PVCs become frequent and BP drops. What should the nurse do first? A. Stop the infusion immediately. B. Administer lidocaine. C. Notify provider. D. Decrease dose by 50%. Answer. A. Stop the infusion immediately. Rationale. Dobutamine toxicity causes dysrhythmias and hypotension. Stopping prevents cardiac collapse. Question 21. A patient on high-dose norepinephrine and dexmedetomidine becomes acutely bradycardic, HR 38 BPM, with MAP 60 millimeters of mercury and decreased urine output. Which action should the nurse take first? A. Increase the norepinephrine infusion rate. B. Stop dexmedetomidine infusion and reassess hemodynamics. C. Give a fluid bolus of 1 LNS immediately. D. Administer atropine 0.5 milligrams IV. Answer. B. Stop dexmedetomidine infusion and reassess hemodynamics. Rationale. Dexmedetomidine can cause profound bradycardia. Stopping the sedative may reverse bradycardia and improve MAP before escalating vasopressors or giving atropine. Question 22. A mechanically ventilated patient triggers the high-pressure alarm. The nurse notes the ventilator shows increased peak inspiratory pressure, and the patient is visibly anxious and coughing. What is the nurse's first action? A. Disconnect the ventilator and bag the patient. B. Assess for endotracheal tube obstruction or patient ventilator dysynchrony. C. Suction the ETT immediately without assessment. D. Sedate and paralyze the patient. Answer. B. Assess for endotracheal tube obstruction or patient ventilator dysynchrony. Rationale. Rapid assessment, tube kink obstruction, secretions, biting, coughing, bronchospasm, or dysynchrony. Identifies reversible causes before invasive or measures. Question 23. A patient on propofol infusion and fentanyl infusion for sedation develops hypotension and increasing lactate. Norepinephrine is started. Urine output falls. What combined consideration is most urgent? A. Increase propofol dose to deepen sedation. B. Consider propofol infusion syndrome and stop propofol. C. Increase fentanyl to control pain and decrease vasopressor needs. D. Add vasopressin to the norepinephrine infusion. Answer. B. Consider propofol infusion syndrome and stop propofol. Rationale. Propofol infusion syndrome, acidosis, lactate, rhabdomyolysis, cardiovascular collapse can be precipitated by high-dose or long infusions. Stopping propofol is urgent while assessing hemodynamics. Question 24. A paralyzed cisatracurium, ventilated patient on continuous sedation shows absence of spontaneous breaths, but end-tidal CO2 rises and oxygenation worsens. The nurse notes no breath sounds and high plateau pressures. What is the best immediate action? A. Increase FiO2 and continue current settings. B. Stop paralytic to allow spontaneous breathing. C. Check ventilator circuit and perform manual ventilation with bag valve while assessing the patient. D. Give a bronchodilator. Answer. C. Check ventilator circuit and perform manual ventilation with bag valve while assessing the patient. Rationale. In an apneic or paralyzed patient, loss of ventilation or circuit failure is life-threatening. Manual ventilation confirms patient oxygenation and helps identify cause. Question 25. An ICU patient receiving both amiodarone and haloperidol develops new irregular wide QRS and QTC prolongation. What is the most appropriate immediate action? A. Continue both meds and monitor. B. Hold haloperidol and notify the provider. C. Administer IV magnesium empirically and prepare for cardioversion. D. Give IV calcium gluconate. Answer. C. Administer IV magnesium empirically and prepare for cardioversion. Rationale. Combined QT prolonging drugs increase risk of torsades. Magnesium stabilizes myocardium, and preparing for urgent cardioversion addresses imminent ventricular arrhythmia risk. Question 26. A patient on continuous insulin infusion for hyperkalemia is also receiving intermittent high-dose corticosteroids. Blood glucose becomes erratic with wide fluctuations. What is the best nursing response? A. Stop insulin infusion and resume later. B. Increase insulin infusion rate empirically. C. Institute hourly glucose monitoring and adjust insulin per protocol. D. Give subcutaneous basal insulin only. Answer. C. Institute hourly glucose monitoring and adjust insulin per protocol. Rationale: steroids cause hyperglycemia. Tight hourly monitoring and protocol-driven titration prevents hypo or hyperglycemia during dynamic interactions. Question 27. A patient on vecuronium neuromuscular blocker and continuous sedative develops sudden tachycardia, fever, and unexplained rigidity despite paralysis. What should the nurse suspect and do first? A. Increase vecuronium dose. B. Suspect malignant hyperthermia and notify the provider while discontinuing triggering agents. C. Administer dantrolene IM. D. Obtain blood cultures. Answer: B. Suspect malignant hyperthermia and notify the provider while discontinuing triggering agents. Rationale: rigidity, hyperthermia, and tachycardia suggest malignant hyperthermia or serotonin syndrome. Stop triggers and activate emergency treatment. Dantrolene IV. Immediately. Question 28. A ventilated patient develops progressive metabolic acidosis. The team increases minute ventilation to compensate, but the patient becomes hypotensive and shows decreased venous return. What pharmacologic or ventilator trade-off should the nurse raise with the team? A. Continue high minute ventilation to normalize pH. B. Consider permissive hypercapnia to avoid hemodynamic collapse. C. Give more sedatives to reduce oxygen consumption. D. Increase PEEP to improve oxygenation. Answer: B. Consider permissive hypercapnia to avoid hemodynamic collapse. Rationale: aggressive ventilation can reduce venous return and worsen hypotension. Permissive hypercapnia balances oxygenation and hemodynamics in select critical care cases. Question 29. A patient receiving continuous vecuronium and fentanyl has absent spontaneous movement, but pupils are reactive and the BIS, bispectral index, alarm shows low sedation depth. What is the immediate nursing concern? A. Patient is adequately sedated. B. Paralysis without adequate sedation, potential awareness. Increase sedation immediately. C. Decrease vecuronium to allow movement. D. Document and continue. Answer: B. Paralysis without adequate sedation, potential awareness. Increase sedation immediately. Rationale: neuromuscular blockade without adequate sedation risks intraoperative or ICU awareness and PTSD. Correct sedation level must be ensured immediately. Question 30. A patient on combined opioid infusion and MAOI therapy becomes diaphoretic, hyperreflexic, and hypertensive. Which emergency is likely and what should the nurse do first? A. Serotonin syndrome. Stop offending drugs and notify provider. B. Neuroleptic malignant syndrome. Cool the patient. C. Hypoglycemia. Check glucose. D. Opioid overdose. Give naloxone. Answer: A. Serotonin syndrome. Stop offending drugs and notify provider. Rationale: MAOI plus serotonergic opioids risk serotonin syndrome. Immediate cessation of serotonergic agents and supportive care reduces mortality. Question 31. An ICU patient receiving concurrent amphotericin B and vancomycin shows rising creatinine and decreasing urine output. The provider asks to continue both. What is the nurse's safest action? A. Continue both and monitor daily labs. B. Hold vancomycin and notify provider about nephrotoxic synergy. C. Increase IV fluids to flush kidneys. D. Administer loop diuretic. Answer: B. Hold vancomycin and notify provider about nephrotoxic synergy. Rationale: amphotericin plus vancomycin increases nephrotoxicity risk. Nurse must escalate concern and recommend medication review to prevent renal failure. Question 32. A patient on ECMO is receiving multiple sedatives and anticoagulation. The patient develops sudden limb swelling and decreasing circuit flow. Which immediate nursing action is required? A. Increase anticoagulant infusion rate. B. Assess the cannula sites and check for thrombosis or kinking, and notify ECMO team. C. Bolus normal saline into circuit. D. Stop all sedatives. Answer. B. Assess the cannula sites and check for thrombosis or kinking, and notify ECMO team. Rationale. Limb swelling and decreased flow suggest cannula obstruction or thrombosis. Prompt assessment and ECMO team intervention prevent catastrophic circuit failure. Question 33. A patient on continuous ketamine infusion for sedation demonstrates sudden hypertension, hallucinations, and nystagmus. The team asks the nurse to double the dose to deepen sedation. What is the nurse's best response? A. Double the ketamine dose as requested. B. Recognize adverse effects of ketamine and request alternative sedative or reduced dose. C. Add benzodiazepine on top of current regimen. D. Administer haloperidol for hallucinations and continue ketamine. Answer. B. Recognize adverse effects of ketamine and request alternative sedative or reduced dose. Rationale. Ketamine can cause sympathomimetic and psychomimetic effects. Increasing dose may worsen toxicity. Consider alternative sedation strategies. Question 34. A ventilated patient with severe ARDS on high PEEP receives a bolus of morphine and becomes hypotensive with new wide pulse pressure. What physiologic interaction should the nurse anticipate? A. Morphine causes histamine release and vasodilation, which combined with high intrathoracic pressure reduces venous return, causing hypotension. B. Morphine increases cardiac contractility and BP. C. Morphine has no hemodynamic effect in ventilated patients. D. Morphine increases PEEP effect beneficially. Answer. A. Morphine causes histamine release and vasodilation, which combined with high intrathoracic pressure reduces venous return, causing hypotension. Rationale. In high PEEP, venous return is already compromised. Vasodilation from morphine can precipitate severe hypotension. Anticipate and treat accordingly. Question 35. A patient receiving linezolid and methadone becomes diaphoretic, hyperreflexic, and has inducible clonus. The nurse recognizes serotonin toxicity. Which medication should the nurse expect to administer? A. Cyproheptadine orally or via NG tube. B. Naloxone IV. C. Dantrolene IV. D. Flumazenil IV. Answer. A. Cyproheptadine orally or via NG tube. Rationale. Cyproheptadine is a serotonin antagonist used in serotonin syndrome. Naloxone and dantrolene are for other toxicities. Question 36. A critically ill patient on combined aminoglycoside and loop diuretic therapy reports new hearing loss and vertigo. What is the immediate nursing priority? A. Continue therapy and monitor. B. Hold the aminoglycoside and notify provider for ototoxicity evaluation. C. Give IV steroids. D. Increase diuretic dose. Answer. B. Hold the aminoglycoside and notify provider for ototoxicity evaluation. Rationale. Aminoglycoside plus loop diuretic potentiates ototoxicity. Immediate cessation may prevent permanent hearing loss. Question 37. A patient sedated with benzodiazepine infusion and on mechanical ventilation suddenly has prolonged apnea after an unexpected renal impairment develops. What opioid or benzodiazepine pharmacokinetic issue should the nurse highlight to the team? A. Accumulation of active benzodiazepine metabolites due to decreased renal clearance, prolonged sedation, and apnea. B. Renal impairment has no effect on benzodiazepines. C. Increased clearance reduces sedative effect. D. Renal impairment only affects opioids, not benzodiazepines. Answer: A. Accumulation of active benzodiazepine metabolites due to decreased renal clearance, prolonged sedation, and apnea. Rationale: some benzodiazepines, for example midazolam metabolites, can accumulate in renal failure, causing prolonged sedation or apnea. Dose adjustments needed. Question 38. A patient receiving vasopressors and an IV antifungal voriconazole shows new prolonged QT and torsades risk. The team wants to add haloperidol for agitation. What should the nurse advise? A. Add haloperidol, it's safe. B. Avoid haloperidol due to additive QT prolongation and recommend alternative, for example quetiapine with cardiac consult. C. Give haloperidol IM as 1 dose. D. Stop voriconazole and give haloperidol. Answer: B. Avoid haloperidol due to additive QT prolongation and recommend alternative, for example quetiapine with cardiac consult. Rationale: multiple QT prolonging drugs increase torsades risk. Avoid additional QT agents and consult cardiology for safe alternatives. Question 39. A multi-trauma patient on continuous ketorolac and enoxaparin develops rising drain output and hypotension. What is the priority nursing action related to drug interaction? A. Continue both and observe. B. Hold anticoagulant and NSAID and notify provider for bleeding evaluation. C. Increase IV fluids only. D. Reverse anticoagulation immediately with vitamin K. Answer: B. Hold anticoagulant and NSAID and notify provider for bleeding evaluation. Rationale: combined anticoagulant plus NSAID increases bleeding risk. Holding both and prompt evaluation prevents hemorrhagic shock. Question 40. An ICU patient on multi-drug therapy develops new acute kidney injury. Several drugs require renal dosing. What is the nurse's most impactful immediate action? A. Continue all meds and recheck creatinine daily. B. Hold nephrotoxic and renally cleared drugs and notify pharmacist or provider for dose adjustments. C. Start renal replacement therapy immediately. D. Double antibiotic doses to maintain troughs. Answer: B. Hold nephrotoxic and renally cleared drugs and notify pharmacist or provider for dose adjustments. Rationale: promptly holding or adjusting renally cleared or nephrotoxic meds prevents worsening AKI and toxicity. Pharmacy collaboration ensures safe dosing. Question 41. A mechanically ventilated ICU patient on high-dose norepinephrine and continuous dexmedetomidine becomes acutely bradycardic, heart rate 34, and hypotensive. What should the nurse do first? A. Bolus 1 LNS immediately. B. Stop dexmedetomidine and reassess hemodynamics. C. Double the norepinephrine infusion. D. Administer atropine without changing sedation. Answer: B. Stop dexmedetomidine and reassess hemodynamics. Rationale: dexmedetomidine can cause profound bradycardia and hypotension, especially with vasopressors. Stopping the sedative may reverse bradycardia before escalating vasopressors or giving meds. Question 42. A ventilated patient triggers repeated high-pressure alarms. The nurse notes rising peak pressures, decreased delivered tidal volume, and the patient is biting the endotracheal tube. What is the most appropriate immediate action? A. Increase ventilator tidal volume. B. Insert an oropharyngeal airway and provide sedation or analgesia. C. Perform immediate bronchoscopy. D. Disconnect ventilator and manual bag. Answer: B. Insert an oropharyngeal airway and provide sedation or analgesia. Rationale: patient ventilator dysynchrony from tube biting raises pressures. Airway adjunct and sedation relieve obstruction and prevent harm. Manual ventilation is reserved if ventilation fails. Question 43. A sedated, paralyzed ICU patient on continuous fentanyl and midazolam has reactive pupils, but BIS alarm indicates low sedation depth. What is the nurse's priority? A. Increase paralytic dose. B. Increase sedation infusion to achieve target depth. C. Wake patient to assess neurologic status. D. Document and continue current rates. Answer. B. Increase sedation infusion to achieve target depth. Rationale. Paralyzed patients cannot show movement. Paralysis without adequate sedation risks awareness and psychological trauma. Adjust sedation promptly. Question 44. A patient on propofol infusion for sedation develops rising lactate, worsening metabolic acidosis, bradyarrhythmia, and refractory hypotension. What immediate action should the nurse take? A. Continue propofol and give bicarbonate. B. Stop propofol and notify provider. Prepare alternative sedation. C. Lower infusion rate by 10%. D. Add vasopressin to support BP. Answer. B. Stop propofol and notify provider. Prepare alternative sedation. Rationale. Clinical picture suggests propofol infusion syndrome. Immediate discontinuation is critical to prevent fatal outcome. Question 45. A ventilated ERDS patient on high PEEP suddenly develops hypotension and sharp increase in central venous pressure. What is the nurse's best first action? A. Increase PEEP further to improve oxygenation. B. Reduce PEEP or ventilator pressures and notify provider. C. Give bolus of furosemide. D. Reposition to prone immediately. Answer. B. Reduce PEEP or ventilator pressures and notify provider. Rationale. Excessive intrathoracic pressure from high PEEP can reduce venous return, causing hypotension. Reducing PEEP may restore hemodynamics. Question 46. A patient receiving vancomycin and gentamicin has rising creatinine and decreasing urine output. The provider wants to continue both. What is the nurse's most appropriate action? A. Continue both and monitor urine hourly. B. Hold gentamicin and discuss nephrotoxicity risk with provider or pharmacy. C. Bolus IV fluids and continue drugs. D. Add a diuretic to protect kidneys. Answer. B. Hold gentamicin and discuss nephrotoxicity risk with provider or pharmacy. Rationale. Aminoglycosides plus vancomycin markedly increased nephrotoxicity risk. Nurse must escalate concern and recommend alternative therapy or dosing adjustments. Question 47. A patient on warfarin and high-dose IV cephalosporin develops melena and hypotension. IN are returns greater than 6.0. What is the nurse's priority action? A. Give oral vitamin K at next meal. B. Hold warfarin and prepare to administer IV vitamin K and blood products per protocol. C. Continue warfarin and observe. D. Increase cephalosporin dose. Answer. B. Hold warfarin and prepare to administer IV vitamin K and blood products per protocol. Rationale. Active GI bleeding with supertherapeutic IN requires immediate reversal and resuscitation. Nurse should act per bleeding protocol. Question 48. A sedated patient on continuous ketamine infusion becomes hypertensive, diaphoretic, and develops visual hallucinations. The team suggests doubling the ketamine to deepen sedation. What should the nurse do? A. Double the ketamine per order. B. Hold or freeze escalation and request alternative sedative or adjunct benzodiazepine after discussing risks. C. Give haloperidol IM and continue ketamine. D. Stop ketamine and extubate. Answer. B. Hold or freeze escalation and request alternative sedative or adjunct benzodiazepine after discussing risks. Rationale. Ketamine toxicity causes sympathomimetic and psychomimetic effects. Increasing dose likely worsens symptoms. Seek safer alternatives. Question 49. A ventilated patient receiving morphine PCA and lorazepam infusion suddenly has respiratory rate 6, SpO2 82%, and pinpoint pupils. Naloxone is ordered, but the patient is also benzodiazepine sedated. What is the nurse's best action? A. Give naloxone and observe. B. Give flumazenil first, then naloxone. C. Give naloxone and be prepared to administer flumazenil if indicated, while supporting airway or ventilation. D. Do not give antidotes. Increase oxygen only. Answer. C. Give naloxone and be prepared to administer flumazenil if indicated, while supporting airway or ventilation. Rationale. Opioid reversal is emergent for respiratory depression. Naloxone first, with airway support. Flumazenil use is riskier in chronic benzo users and may precipitate seizures. Use cautiously. Question 50. A patient on ECMO develops hemolysis, rising serum potassium, and ventricular ectopy. The team asks to increase heparin infusion. What is the nurse's most immediate safety action? A. Increase heparin as requested. B. Draw labs potassium ion hemolysis markers. Notify ECMO team and prepare for emergent potassium lowering measures. C. Decrease ECMO flow. D. Bolus calcium gluconate and leave heparin unchanged. Answer. B. Draw labs potassium ion hemolysis markers. Notify ECMO team and prepare for emergent potassium lowering measures. Rationale. Hemolysis with hyperkalemia causes arrhythmia risk. Addressing potassium and identifying hemolysis source is acute priority before anticoag changes. Question 51. A patient on dual vasopressors, norepinephrine plus vasopressin, and continuous fentanyl becomes increasingly acidotic, pH 7.10. The team plans to increase vasopressors to maintain MAP. What ventilation or medication trade-off should the nurse advocate? A. Increase minute ventilation aggressively to correct pH immediately. B. Discuss limiting vasopressor escalation and optimizing perfusion, fluids, inotropes, because excessive vasoconstriction worsens tissue hypoperfusion and lactic acidosis. C. Add norepinephrine boluses frequently. D. No change. Continue plan. Answer. B. Discuss limiting vasopressor escalation and optimizing perfusion, fluids, inotropes, because excessive vasoconstriction worsens tissue hypoperfusion and lactic acidosis. Rationale. Excessive vasopressor-induced vasoconstriction can worsen lactic acidosis. Nurse should advocate for strategies that improve perfusion rather than just raising MAP. Question 52. A ventilated patient with suspected autoPEEP has difficulty triggering the ventilator and high intrinsic PEEP. Which immediate nursing intervention is appropriate? A. Increase tidal volume. B. Shorten expiratory time by increasing respiratory rate. C. Decrease set respiratory rate and allow longer expiratory time. Consider bronchodilator and sedation. D. Switch to pressure control and increase PEEP. Answer. C. Decrease set respiratory rate and allow longer expiratory time. Consider bronchodilator and sedation. Rationale. Auto-PEEP results from inadequate exhalation. Giving more expiratory time and treating bronchospasm reduces intrinsic PEEP and improves triggering. Question 53. A patient receiving linezolid and methadone develops hypertension, hyperthermia, and clonus. The provider asks to give meperidine for pain. What is the nurse's response? A. Give meperidine as ordered. B. Hold meperidine and explain risk of worsening serotonin syndrome. Request alternative analgesic. C. Administer meperidine and monitor. D. Stop linezolid immediately and give meperidine. Answer. B. Hold meperidine and explain risk of worsening serotonin syndrome. Request alternative analgesic. Rationale: meperidine is serotonergic and can exacerbate serotonin syndrome. Avoid adding serotonergic opioids. Question 54. A patient on prolonged high-dose sedatives and paralytics shows no spontaneous respirations during weaning trial despite acceptable oxygenation. Pupils are equal or reactive and CXR is clear. What is the nurse's most important next step? A. Extubate, since oxygenation is good. B. Assess for neuromuscular blockade, residual, and request Train-of-4 and drug level checks. Consider reversal. C. Increase sedation. D. Begin spontaneous breathing trial again in 1 hour. Answer: B. Assess for neuromuscular blockade, residual, and request Train-of-4 and drug level checks. Consider reversal. Rationale: residual paralytic effect prevents spontaneous breathing. Train-of-4 helps detect blockade and guide reversal to allow safe weaning. Question 55. An ICU patient on voriconazole and amiodarone demonstrates new QT prolongation. The team suggests adding haloperidol for agitation. What should the nurse do? A. Approve haloperidol IM to control agitation quickly. B. Advocate against additional QT prolonging medication and suggest alternative non-QT agents or cardiac consult. C. Stop voriconazole and give haloperidol. D. Continue current plan. QT prolongation is mild. Answer: B. Advocate against additional QT prolonging medication and suggest alternative non-QT agents or cardiac consult. Rationale: multiple QT prolonging agents increase torsades risk. Nurse should prevent additive effects and seek safer options. Question 56. A ventilated patient receiving remifentanil and propofol for sedation has abrupt loss of PG signal and tonic-clonic movements. What is the nurse's immediate action? A. Increase propofol infusion. B. Stop infusions and treat as possible seizure. Secure airway. Administer benzodiazepine IV. C. Call neuro consult only. D. Document and continue monitoring. Answer: B. Stop infusions and treat as possible seizure. Secure airway. Administer benzodiazepine IV. Rationale: seizure activity requires immediate cessation of potential offending agents and anticonvulsant therapy while protecting airway. Question 57. A patient on continuous norepinephrine and high-dose steroid therapy develops hyperglycemia and new atrial fibrillation. The team orders a short-acting beta blocker IV to control rate. What is the nursing consideration? A. Give beta blocker immediately, no concerns. B. Consider hemodynamic reserve. Assess MAP and perfusion first, because beta blockers may worsen hypotension in vasopressor-dependent patients. C. Substitute with oral beta blocker. D. Increase steroid dose first. Answer: B. Consider hemodynamic reserve. Assess MAP and perfusion first, because beta blockers may worsen hypotension in vasopressor-dependent patients. Rationale: rate control with beta blockers can reduce cardiac output and MAP. Ensure adequate perfusion before administering. Question 58. A patient on continuous infusion of an aminoglycoside and loop diuretic reports sudden tinnitus and vertigo. The nurse is preparing to act. What is the correct immediate step? A. Continue therapy and schedule audiology. B. Hold aminoglycoside and loop diuretic and notify provider for immediate evaluation. C. Give IV steroid to reverse symptoms. D. Decrease aminoglycoside dose by 50%. Answer: B. Hold aminoglycoside and loop diuretic and notify provider for immediate evaluation. Rationale: combined ototoxic agents potentiate hearing damage. Holding both may prevent permanent loss and prompt alternative therapy. Question 59. A patient with severe ARDS on ECMO is sedated with multiple agents. During sedative escalation, the nurse notes rising bilirubin and coagulopathy. What immediate multidisciplinary action should the nurse prompt? A. Continue current sedative plan. Labs will normalize. B. Call hepatology, ECMO, pharmacy to review medication hepatotoxicity and consider dose reduction or substitution. C. Increase anticoagulation to manage coagulopathy. D. Stop ECMO. Answer. B. Call hepatology, ECMO, pharmacy to review medication hepatotoxicity and consider dose reduction or substitution. Rationale: new hepatic dysfunction in a complex patient on multiple drugs requires urgent multidisciplinary review to identify and stop hepatotoxic agents and manage coagulopathy. Question 60. A ventilated patient on continuous infusion of cisatracurium is noted to have sudden unexplained hypotension and tachycardia during a sedative change. What urgent evaluation or action should the nurse perform? A. Increase paralytic infusion rate. B. Assess for anaphylaxis to new sedative, airway, skin, pressors, and stop offending agent. C. Bolus IV fluids and continue medications. D. Document and recheck in 30 minutes. Answer. B. Assess for anaphylaxis to new sedative, airway, skin, pressors, and stop offending agent. Rationale: acute hemodynamic instability immediately after medication change suggests possible anaphylaxis. Stop suspected drug, secure airway, and treat per protocol. Question 61. A patient with septic shock on norepinephrine and vasopressin develops mottled skin, weak pulses, and rising lactate. What should the nurse advocate next? A. Increase vasopressin dose. B. Add an inotrope such as dobutamine to improve perfusion. C. Bolus with more crystalloids. D. Administer an antihypertensive. Answer. B. Add an inotrope such as dobutamine to improve perfusion. Rationale: persistent hypoperfusion despite vasopressors indicates poor cardiac output. Adding an inotrope enhances contractility and improves tissue oxygenation. Question 62. A patient receiving IV nitroprusside for hypertensive crisis suddenly becomes confused with metabolic acidosis and almond-like breath odor. What is the nurse's priority? A. Titrate infusion upward. B. Stop nitroprusside and notify provider immediately. C. Give an antihypertensive bolus. D. Increase IV fluids. Answer. B. Stop nitroprusside and notify provider immediately. Rationale: these findings indicate cyanide toxicity, a life-threatening complication of nitroprusside, requiring immediate discontinuation and antidote, hydroxycobalamin. Question 63. A patient on IV insulin infusion for DKA has a potassium level of 2.9 milliequivalent per liter. What is the nurse's best action? A. Continue insulin at current rate. B. Hold insulin and replace potassium before continuing. C. Increase insulin rate to correct acidosis faster. D. Give bicarbonate infusion. Answer. B. Hold insulin and replace potassium before continuing. Rationale: insulin drives potassium into cells, worsening hypokalemia and risking arrhythmias. Potassium must be corrected prior to insulin continuation. Question 64. A patient receiving IV amiodarone develops cough, dyspnea, and new crackles. What should the nurse do first? A. Notify provider and prepare to discontinue amiodarone. B. Increase dose to suppress arrhythmia. C. Administer diuretics immediately. D. Encourage incentive spirometry. Answer. A. Notify provider and prepare to discontinue amiodarone. Rationale: Amiodarone-induced pulmonary toxicity presents as new respiratory symptoms. Immediate discontinuation is necessary to prevent respiratory failure. Question 65. A patient on dopamine infusion for cardiogenic shock develops tachycardia and chest pain. What is the nurse's immediate action? A. Continue infusion and monitor. B. Decrease dopamine rate and notify provider. C. Bolus fluids. D. Add norepinephrine. Answer. B. Decrease dopamine rate and notify provider. Rationale. High-dose dopamine causes excessive beta stimulation, increasing myocardial oxygen demand and worsening ischemia. Dose reduction prevents complications. Question 66. A patient on continuous heparin for pulmonary embolism reports flank pain and shows drop in hemoglobin. What is the nurse's first action? A. Continue heparin and reassess later. B. Stop heparin and notify provider immediately. C. Give a diuretic. D. Increase IV fluids. Answer. B. Stop heparin and notify provider immediately. Rationale. Flank pain and hemoglobin drop suggest retroperitoneal bleeding. Anticoagulation must be stopped to prevent further hemorrhage. Question 67. A ventilated patient receiving midazolam and fentanyl becomes hypotensive after a bolus. What is the nurse's first intervention? A. Start a vasopressor immediately. B. Reduce sedation rate and reassess blood pressure. C. Give additional sedative. D. Turn patient supine. Answer. B. Reduce sedation rate and reassess blood pressure. Rationale. Benzodiazepines and opioids depress cardiac output and cause vasodilation. Reducing rate prevents worsening hypotension. Question 68. A patient with septic shock on norepinephrine has a newly cold, cyanotic hand at the IV infusion site. What should the nurse do first? A. Apply warm compresses. B. Stop infusion and administer phentolamine per protocol. C. Elevate the arm. D. Continue infusion. This is expected. Answer. B. Stop infusion and administer phentolamine per protocol. Rationale. Extravasation of norepinephrine causes vasoconstriction and tissue necrosis. Immediate antidote administration prevents permanent damage. Question 69. A patient receiving digoxin and furosemide develops nausea, visual halos, and irregular pulse. What should the nurse do first? A. Hold digoxin and check potassium and digoxin level. B. Continue both medications. C. Give antiemetic and recheck later. D. Administer potassium chloride immediately. Answer. A. Hold digoxin and check potassium and digoxin level. Rationale. Digoxin toxicity is exacerbated by hypokalemia. Stopping digoxin and verifying serum levels prevents arrhythmia progression. Question 70. A patient on total parenteral nutrition, TPN, develops shortness of breath and chest pain during bag change. What is the nurse's priority action? A. Continue infusion at a slower rate. B. Clamp catheter and position patient on left side with head down. C. Increase oxygen flow. D. Administer heparin. Answer. B. Clamp catheter and position patient on left side with head down. Rationale. Sudden dyspnea during TPN change indicates air embolism. Left lateral Trendelenburg traps air in the right atrium to prevent embolization. Question 71. A patient on propofol develops triglyceride level greater than 800 milligrams per deciliter and metabolic acidosis. What is the nurse's best action? A. Continue infusion and monitor labs. B. Stop propofol and notify provider immediately. C. Give IV fluids to dilute lipids. D. Reduce propofol by 50%. Answer. B. Stop propofol and notify provider immediately. Rationale: hypertriglyceridemia and acidosis indicate propofol infusion syndrome, a potentially fatal complication requiring immediate discontinuation. Question 72. A patient with renal failure on a nitroglycerin infusion develops profound hypotension after receiving sildenafil earlier. What is the nurse's next step? A. Increase IV fluids and continue nitroglycerin. B. Stop nitroglycerin immediately and notify provider. C. Give another antihypertensive. D. Reduce the infusion rate gradually. Answer: B. Stop nitroglycerin immediately and notify provider. Rationale: combining nitrates with sildenafil causes life-threatening hypotension due to synergistic vasodilation. Both must be avoided together. Question 73. A patient on continuous insulin infusion develops confusion, sweating, and tremors. The nurse checks glucose, 48 milligrams per deciliter. What is the immediate action? A. Stop insulin and give 50% dextrose IV. Continue infusion and recheck glucose in 15 minutes. C. Give glucagon IM only. D. Notify provider first. Answer: A. Stop insulin and give 50% dextrose IV. Rationale: severe hypoglycemia requires immediate correction with IV dextrose to prevent neurological injury. Question 74. A patient receiving IV lidocaine for arrhythmia begins showing slurred speech and confusion. What is the nurse's best initial action? A. Notify provider and stop the infusion. B. Increase infusion rate. C. Document and continue therapy. D. Give antiemetic. Answer: A. Notify provider and stop the infusion. Rationale: neurologic changes are early signs of lidocaine toxicity. Stopping the infusion prevents seizures and cardiac depression. Question 75. A patient on high-dose steroids for septic shock develops blood glucose 420 milligrams per deciliter, confusion, and dehydration. What is the nurse's next action? A. Administer insulin and IV fluids per protocol. B. Continue steroids unchanged. C. Withhold insulin until provider evaluates. D. Reduce IV fluids. Answer: A. Administer insulin and IV fluids per protocol. Rationale: corticosteroids can cause steroid-induced hyperglycemia, prompt glucose control and rehydration, prevent DKA and osmotic diuresis. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.